Please introduce yourself and tell me a little bit about yourself.
My name is Marianne Tallberg and I graduated as a nurse in Helsinki, Finland in 1950. I didn't get my public health nurse graduation before 1975 when I studied at the same time with my own children. And after that I started as a teacher at the Swedish nursing school in Helsinki.
How did you get involved in nursing informatics?
In 1978 I was at the board for the Finnish Nurses Association. We had an association, the Nordic Nurses Association, and the Danish nurses were very anxious because a new hospital information system started, and they thought that the system would change the nurses' work and positions. So the Finnish Nurses Association told me to map out what was going on in computing in healthcare in Finland. And that was a very interesting job. I found out that 3 hospitals had informatics nurses. That was the Oulu and Helsinki University hospitals, and also in a small town, Seinäjoki, the regional hospital. And these nurses told me very much about how they worked, and I thought it could be a very good thing for nurses to continue to be interested in this new computerization in the hospitals and healthcare. In Finland, in Kuopio, at Kuopio University and in Varkaus city, the doctor at the health center was interested in also in computing in healthcare, and they started in 1979 the so-called WOTTI project. They made the patient record on a mumps-based system, and this Finstar project is still going now in the 2000s.
How did you share your enthusiasm in nursing informatics with others?
You see, I had, in Stockholm, in the symposium, we had there with the Nordic Nurses Association, I had met Ulla Jardin, and she had worked already a little bit with computing in a hospital, and she had got me even more interested and enthusiastic than I was before. So when I was back home, as I had told you, I was a teacher at the Swedish nursing school. I started immediately to teach my students about how computers will be integrated in nursing. They didn't always like it very much, and you see, you couldn't, at that time, there weren't any PCs and such things, so you had to go to the bank for looking at how they worked with computers, and we did go to Helsinki University Hospital and look at their computer room. But you know, a computer room at that time didn't tell the students very much about it. I had a great help from Hanna Kalpa, who was the informatics nurse at the Helsinki University Hospital, she helped me to enthusiasm my students for this very, very new thinking.
And you did go to the first International Nursing Informatics Conference in London.
Yes, I did. And in London, I met Maureen Schulz and Barry Barber, who were the enthusiasts behind this conference. And I was also visiting the London hospital, where they really had computers working. And in their intensive care ward, it really helped the nurses. It was interesting to see. You could say it was quite modern already then.
So that was 1982. After the conference, how did you continue your work in Finland?
Medinfo 1983 confirmed that we had a nursing informatics group. In Finland, our small Finnish informatics association was a member of the European Federation of Medical Informatics. And in 1985, we had to arrange the European Federation for Medical Informatics conference, the MIE 1985. And I was a member of the organizing committee for organizing a nursing day during the conference. Maureen Schulz came to Helsinki and helped me to sketch for the program for the nursing day. And we had very many good speakers from Finland also, but naturally from very many Americans.
What was the first international project you were involved with?
In 1985, a project called System Development Environments and Professional-Oriented Language, Sydpol, started. Ulla Gerdin and Hans Petersson from Sweden were engaged in this project and asked me if there could be a Finnish part in the project. And at that time, I asked the Finstar project to join this. It was a quite interesting project. We studying working experience, methods and possibilities for computers in the healthcare area. And I learned a lot.
When you think back to first getting involved in nursing informatics, what are some of the early events that you recall?
The third nursing informatics conference that took place in Calgary was a very interesting conference. There I got aware of how necessary it was with data protection, and also that you always had to think about the ethical things when you have to do with patients. And after that, in 1986, we had the Medinfo in Washington, and it was, I found myself very welcome to this event. I learned to know many nurses at this conference, and Patty Brennan was celebrating her doctorate at this moment, and I was asked to join in, and the warm friendship with very many people that started at that conference. I will meet them. I have met them very many times afterwards, and it's nice to have so many international friends.
And what happened in Europe in the 80s?
When I was in Washington, I was taken to the National Library on Medicine, and there Susan Sparks at the Learning Center opened a new world for my age. And so I was very happy in 1987 when Ulla Jardin and Hans Pettersson started a task force on education. And we worked on preparing nursing for information systems, and also wrote a small book with recommendation on informatics competencies. And at that time, you know, Sue Grove came also to Finland and helped me with the next very big task for me, and that was to arrange a nursing day at the MIE 87 conference in Rome. It was a big happening for nurses, this conference in Rome. And that was happening a very funny thing. You know, when the nurse Yvonne Elsing from Switzerland gave the keynote speech, the light did go out, and she didn't matter at all. She switched on her torch and continued.
After the Rome, you did start the FMI Working Group 5, did you?
Well, you see, in 1988, we had the Nursing Informatics Conference in Dublin, and we were 1,000 nurses. And that was a fantastic feeling. After that, we had the MIE 88 in Oslo. And then I asked the FMI board if I could start a European nursing group, because I saw that there were so many European nurses that really needed to get some work done also in Europe. And the FMI board gave its okay, and so in 1989 at the MedInfo in Singapore, we had the first meeting of the FMI Working Group 5.
And what happened at the university level education?
In 1983, I moved from the nursing school to Helsinki University, where we started the master program in nursing. And I naturally saw to it that we got nursing informatics into the curriculum. I'm very proud that about 10 of my nursing students did go and work with nursing informatics later on. In 1989, I was asked to come to Kuopio University and elevate the education in informatics. It was quite an interesting thing. They had started it already in 1979 to introduce with the so-called VATI project that I told you about earlier, and but these people hadn't had the time to teach anymore, so now it was my job to start it again. the students were very enthusiastic, and later on I was happy to be able to take an European Union project, the so-called EDUCTRA project, to Kuopio. And this project has led to that we today at Kuopio, that's now called the Eastern Finnish University, have a full professor in health informatics, and that is my colleague Kaija Sarantö, who has this professorship.
In that time, also many activities were starting in Europe. Please tell me something about those activities.
In 1998, we had the MIE conference again, and this time in Vienna. And sorry to say, there was not one Austrian nurse, but there were Austrian doctors listening on the nursing day, and they seemed very interested. So perhaps we did something for the Austrian nurses this time. The VG5, the European nursing group, worked quite a lot at that time. In 1991, we helped the nurses in Portugal to have their first own conference, and the following year we were in Greece having the first Greece nursing informatics conference. It was very interesting because we could see a growing interest in informatics in nursing in both these countries.
And then came the Telenurse project.
Yes, that was started in Denmark, and it was on terminology this time. We had many other projects that was started from the European Union, and that was a very good thing when Finland joined the European Union, because then I could work with these projects that were paid from the European Union. One of these projects was the so-called RISE project. It was an open system patient record system, and Ellie Pleuter Wenting from Holland asked me to join an evaluating group for the nursing part of the patient record. And then started also this EDUCTRA project that Ari Hasman had started, and the following IT EDUCTRA project about how to teach informatics for healthcare professionals. And then we had also the Nightingale project that was more thought for educating nurses in informatics. Very interesting projects, all these three.
In the 90s, international nursing informatics conferences also attracted nurses in the field. You did go to the Melbourne in 1991.
No, I was very, very sorry that I couldn't come, but I had to stay in Helsinki at home because I had to defend my doctoral thesis in nursing history at the Kuopio University at the same time.
But after that, what then happened?
Oh, well, in 1994, the Nursing Informatics conference was in San Antonio in Texas, and I had been asked to be on the scientific program committee, and it was a very good conference. The group had made an extremely good job with it. And the post-conference, I had the joy to arrange it together with Bill Holzemer, and I think we did a good job there. The following conference was in Stockholm in 1997, and then I had been asked to be the scientific program chair, and I was also in the organizing committee. There Ulla Jardin was one of, and I worked very near together, and it was a marvelous thing to have a conference so near in a Nordic country. And after we had the post-conference on nursing guidelines and the patient preferences, and that I arranged together with Margareta Enfors.
One of your special interests has always been terminologies.
Yes, it started very early. You see, when I was a nurse teacher in the 70s, the healthcare library, the librarians asked me for help because the students have difficulties with their keywords when they ask the libraries to search for information. And the librarians were so nice that they let me join when the National Library of Medicine came to Helsinki for teaching courses in how to search on Medline and with the mesh keywords. It was very interesting, and there my interest really rose for terminologies, and it has kept since then. And later in the 90s, when the library started a project for which they searched money on making a big terminology for healthcare in Finnish. They asked me to join the project. Unfortunately, we didn't get any money that time. But later, in 1998, the Society for Finnish Nurses Education were willing to put some money in a project for retrieval and indexing of nursing terms. And this project, Hoidokki, is still working, and you can nowadays go in på www.hoidokki.fi for searching in this terminology that's working in 3 languages: Finnish, English and Swedish.
You have also always been interested in history, and you wrote the IMIA and I history together with your colleagues in 1990s.
Yes, you're right. The Nursing Informatics group gave Maureen Scholz, Eli Plöter-Wenting and me an assignment to write the Nursing Informatics group history. And we convened very many times in London in Maureen's home and remembered old times, and it was great fun for every of us. And I found it very interesting to make a comparison to see which questions we had discussed the first times and how the questions through the conferences had changed. The book then was printed and was ready for the conference year 2000 in Auckland.
You have also worked with our living legend, Dr. Professor Virginia Saba, and she has visited Finland several times.
Yes, Virginia is an old friend, and in 2008 she came here with Rosemary Kennedy and Gail Latimer, and Siemens sponsored a symposium here in Helsinki, and it was a great success.
What do you consider to be the most significant achievement in nursing informatics in Finland during your career?
Oh, that is naturally the nursing informatics 2009 that we were very happy to organize in Finland. And I was, for my own part, I was so glad that I could be a member of the scientific and the organizing committees, and so help my colleagues to make a good conference and show that we in Finland really had taken nursing informatics to our hearts. And I was so proud and happy to be able to welcome the other honorary members to a lunch in Helsinki and a small event in Hämeenlinna, that the chairman of the Nurses Association had invited us.
Finally, please tell me, what is your message to young nurses entering in the nursing informatics field?
I should say, don't be afraid of new ideas. You never know what it can become from these ideas, but be critical.
Thank you.